So let's talk about something really strange that happens in medicine. We're going to dive into a practice where a diagnosis is given to a patient, but it's never actually written down in their chart. It's a secret, and it can have some really devastating consequences. Just imagine this for a second. You're getting treatment, right? But the diagnosis your doctor is actually working from is a secret. Maybe even a secret from you. This isn't some plot from a thriller novel. For some patients, this is their actual reality.
And this slide, wow, it just nails the disconnect perfectly. On the left, you see what a doctor might tell a patient. Something like, we're treating your trauma, or we're working on your dissociative identity disorder, that's DID. But then you look at the right side. In the official medical chart, the doctor writes something completely different. Patient has a personality disorder, or even factitious disorder, which is basically a diagnosis for faking it. So you've got this hidden parallel narrative going on, and the crucial question is, why? Why would they do that?
Well, the answer, as it turns out, often comes down to one really powerful emotion: professional fear.
This quote from a provider really gets to the heart of it. There's this very real fear of controversy. The diagnosis of DID is so contested in some medical circles that clinicians actually worry they'll look foolish or, incompetent just for believing it's real. So to avoid that pushback from their colleagues, they secretly choose a diagnosis that feels safer, even if it doesn't really fit what the patient is going through.
And that fear can lead to something like this: a super rigid, almost cinematic checklist for what they think real DID is supposed to look like. It's like they expect patients to fit this stereotype. Hearing voices, having perfect movie-like amnesia, being deeply ashamed. And if a patient's actual real-life experience doesn't match this incredibly narrow script, their whole reality can just be dismissed as atypical and, frankly, suspicious.
Okay, so if providers are scared to officially diagnose DID, what do they do instead? Well, they find a kind of clinical workaround.
So here's how that workaround usually functions. A core symptom of DID is switching between different identity states. But a provider who's skeptical, well, they don't see a switch. As the slide shows, they interpret that as just a really dramatic mood swing. And from there, it gets documented in the chart as emotional dysregulation, which, by the way, is a main symptom of a totally different condition, borderline personality disorder. The real symptom just gets erased and replaced.
And this isn't just a simple mistake, it's a recognized clinical problem. It's actually called diagnostic overshadowing. Once that initial personality disorder label is in the chart, it acts like a pair of tinted glasses. Every new symptom, every crisis is seen through that lens and then wrongly blamed on that first label. It makes it nearly impossible for the true underlying condition to ever be seen or treated the right way.
So now we get to the consequences. Because when you treat the wrong disorder, the therapy that's supposed to help can become actively harmful. Just look at this stark contrast. Proper DID treatment is all about fostering communication between identity states and safely processing trauma. It acknowledges the patient's reality. But when a therapy like dialectical behavior therapy or DBT is misapplied to DID, the whole goal just flips. It becomes about enforcing compliance, basically forcing the patient to stop switching. The alters are no longer seen as parts of a traumatized person, but as bad behaviors that have to be stopped.
And this isn't just a case of being ineffective. The sources are very clear that this approach is actively harmful. Can you imagine being told that a core part of your survival mechanism is just some bad habit you need to stop? It completely invalidates your experience and, honestly, can be deeply re-traumatizing.
And that creates an impossible trap. This quote shows a therapist demanding a patient stop switching, the main symptom of their disorder, before she would even agree to treat the disorder itself. It's a total catch-22. You can't get help for your trauma until you stop having the trauma response you need help for. The patient is just stuck in a loop with absolutely no way out.
So what's the long-term damage of all these secret diagnoses and misinterpreted symptoms? It leads to one really devastating outcome.
It's what the sources call the contaminated chart. This medical record, now it's filled with all these labels: malingering, non-compliance, personality disorders, and it becomes this permanent brand of disbelief. It just follows the patient everywhere, poisoning every future interaction they have, and making sure that each new doctor is already biased against them before they've even walked in the room.
And that contaminated chart creates this massive ripple effect. It's not just about getting the wrong kind of therapy. Once a patient is labeled as difficult, their real physical pain might get dismissed as just attention-seeking. And that leads to delayed medical treatment, incredible suffering, and, in the end, a complete erosion of trust in the very system that is supposed to be helping them.
So it really leaves us with a difficult question.
A provider's fear might be about their own reputation, but the patient is the one who pays the real price, with their health, their trust, and their time. When the system becomes more afraid of a controversial diagnosis than of the actual harm caused by misdiagnosis, who is truly being protected?